My People is proud to present the 40 Days for the FinTechs, an initiative under its Include Everyone program, which is leading the way in advocating for technology that promotes financial inclusivity. Since 2020, we've profiled over 100 FinTechs, and our inaugural edition in Tanzania is shining a spotlight on those breaking down digital barriers and transforming lives for the better.
My name is Franc Mussa, Chief Strategy at Afya Lead. So Afya Lead, this is a youth-led company started at the end of 2020 with the aim of improving the quality of healthcare in Africa. So currently, we are ensuring the accessibility, availability, and affordability of healthcare through innovative solutions that bring seamlessly and convenience to healthcare in Africa. So currently, we are working on 2 products. The first one is Mkanda Salama, a Swahili name which means safe belt, that is a traditionally made locally device designed to stop bleeding immediately after delivery among women with postpartum hemorrhage. But also the second product is Pamoja Bima. Pamoja Bima, this is a micro health insurance that is built between Afya Lead and health insurance schemes in Tanzania to increase the enrollment and simplify payment system in insurance system in Tanzania. One among of the leading cause of maternal death in Africa is PPH, postpartum hemorrhage. So this is excessive bleeding immediately after delivery. So from there, we develop a locally device that is Mkanda Salama, and the idea was that most of African women, they tend to wrap certain clothes in the abdomen. So we developed the product from that idea, where we are using locally available material to produce something that can prevent maternal death. So we did a trial in one of region of Tanzania called Morogoro among 120 women. We found that the Mkanda Salama was 80% effective. So only 20% was remained to make it 100%. That's why we decided to improve it and make it digitally by integrating with IoT, where now we can track some parameters such as pressure, temperature within a smartphone. So this is coming to revolutionize this, because we will be collecting data as well as we are helping this woman to prevent death. So starting with Pamoja Bima is one among of our products, that is InsurTech. So it's available in iOS and Google Play Store. So when you go to Google Play Store, you download the app, then you register, you put your information, then you will see the available insurance schemes that you can buy, and then you will suggest the premium you need. So after that, you will fill up your details, then you will pay. So we try to simplify the process, moving from paper-based process, traditional means, to the digital means, because we're transforming technologically. So we want to transform this technology into healthcare. So it's all in one platform to ensure that people buy insurance seamlessly. But the interesting part is that we have Pamoja Wallet, where we help people, especially from rural areas, to save their money so that they can buy the insurance by installment. So there is no need of paying at once. You can start paying slow by slow, and when you reach the target, you will buy the insurance. So the market problem that we're trying to solve is to ensure that every African person get quality health care, and this is to ensure that we are reaching the universal health coverage as one of our target. Basically, in Africa still, we are adapting the technology. So it's very difficult to tell people in rural areas to use their phone to buy health insurance. So they already have the mindset of traditional means of accessing these services. So first challenge that we're facing when we're rolling out this product is to transform the people's mindset and the behavior of accepting the technology. So we are making much effort in transforming the mindset, as well as we have the aim of pushing this product forward. So basically, first, the African mindset is not yet set to accept the innovation solutions. The other challenge is regulations. African countries, still our regulation is very difficult especially for startups to develop. So you see, we are solving the real problem, but still we are facing regulation difficulties, and also to see the regulators by itself, it's very difficult. So you can find you go and back, so it's forward and back. It's very challenging. Initiative like this is very important, especially in African continent. So in our context, we don't have access to these policymakers, but when we have all in one, it means that the views of startups will be seen by the policymakers. So we're integrating two things at once, at one time. So this platform is very important, and I think it should not be done only once. It should be regularly to ensure that people on the chairs, those policymakers, especially even ministry and other people in the government, they should know what a startup are facing and why are we complaining about regulations, about policies. So Afya Lead is available we have our website, afyalead.co.tz.
Join us in this financial inclusivity revolution, presented in partnership with Level 1 Project, Information and Communication Technologies Commission ICTC, Founders Academy, Cyber PLC Academy, Cross-Leg Technologies, FinTech, Ideation Corner, and the Moduloop Foundation, with generous support from the Bill and Melinda Gates Foundation. Follow #40 Days for the FinTech, #Level 1 Project to learn more and get involved in creating a brighter financial future for all.